Thank you. And thank you for the opportunity to talk about the Norwegian Health Association's work with a peer support training program. My name is May-Hilde Garden, and I work for the Norwegian Alzheimer Association, and I was leading the initial project when we first started up the peer support work last year. Our association have 140 local branches who is dedicated to voluntary dementia work. And these branches have, of course, for years been providing family carers with support by arranging dementia cafes or providing support groups, which are often led by care staff. But although peer support is a well-known service for a range of other conditions in Norway and is highly appreciated by authorities and politicians, we did not have an educational or a support system for a dementia-related peer support. The core of peer support is that people find relief and knowledge and coping, talking to others who have gone through the same experiences. And a person who provides the peer support often have a more processed experience and may have the role as a coach for someone else. We recruited former family carers for persons living with dementia through our association, persons who also are eligible to be peer supporters, meaning they should have a caring perspective or a coping perspective of the caring relation. And they also had to be willing to set some time off to perform the peer support work. And they also had to have the people skills to build trust in their caring relations in the peer support work. Our aim was to provide family carers with skills to be good partners in conversations to promote coping in caring relations. And we advertised the training program in our association, and I also had a brief telephone interview with persons volunteering, just to get to know them better and to make sure that they were eligible to be good peer supporters. And later, in May last year, we spent a weekend together with the 16 first family carers who volunteered to participate in the training program. And during the weekend, they were provided with knowledge concerning their role as being peer supporters, about coping, about coaching, about conversation techniques, and also about how families cope with illness and crisis. And skilled nurses from our dementia helpline carried out the training program. And as you can see, the volunteers did not get any knowledge or education concerning medical or legal themes, because we wanted the volunteers to be focused about being coaches for coping and not give any medical advice. We also chose to divide every theme into 3 parts. First, one theoretical lesson, a lecture to provide the theoretical knowledge concerning the theme. And then 20 to 30 minutes of small group discussion to let the participants focus on their own former caring experiences. And then 20 minutes of plenary discussion in full group. The intention was to provide every theme with a theoretical frame and then relate the theory to the person's personal experiences of caring, and then allow the persons who had already cared for someone to see their personal caring experiences towards the diversity of the caring experiences in the group. Sorry. The peer support workers also got the opportunity to get more exercises in how to use their own former caring experiences in peer support conversations. And persons volunteering also get a chance to attend their yearly follow-up program, a weekend where we invite a researcher similar to give a lecture about a topic. And they also get a chance to practice and get feedback on peer conversations, and also get a chance to exchange their experiences with other peers, of course. Our peers mainly perform the peer support work working locally in the communities by interacting at local meetings, by leading community carers support groups, or by giving lectures at schools for carers, which are very common in Norway. Our association also have provided the opportunities to be peer supported through Facebook groups and on our web pages. And we think that working locally gives the peers a chance to partner up with the local health and care service in providing a better post-diagnostic support for the local families. A quite common way of performing as peer supporters for our volunteers is by leading community support groups. Norway have about 150 care support groups, and even although they are mostly led by care staff, quite a few of them also are co-led by a person with a carer's background. And we find this a really useful combination of knowledges, the lived experience from the carer, and the health promoting perspective from the professional health care worker. And this is a picture from our first training weekend last year. We have a range of peers in different ages, with different relations and with different diagnoses of the person living with dementia. All our peers have agreed to display their contact information and a personal statement on our web pages and in our members' magazine. And this is Grete's example. And the information is also forwarded by our dementia helpline. Many of our peers also have contacted the local newspaper to inform people in the community about their services. We now have a little more than 1 year of experiences with the training program, and so far 28 volunteers have agreed to perform as peer support workers for our association. After the first year, we conducted focus group interviews to gather information on how they find being a peer support worker, and all the participants report of finding the initial training weekend as really meaningful. And they report that the information was really useful and meaningful, and they got the appropriate knowledge to perform as peer support workers. They also report that the training weekend gave them a new and more positive perspective on their own former caring relations. And they all report of being really engaged in the peer support work. The peers mainly report of doing peer support work in the communities by related to schools for carers. Not everyone have received a lot of phone calls, but some have received many, and the calls are quite long, often lasting for an hour or more, and many ask for the opportunity to call back. The peer support workers also report of having different experiences with partnering up with the local health and care service, while some have really close partnership with the services. Many report of also not being acknowledged by the care service as a useful support service to families living with dementia. And the peer support workers also tell us that they find it quite hard to be good partners in peer conversations. They tend to give advice rather than to explore the carer's needs, and they find the coaching exercises really useful. Our association have concluded that peer support can be an important post-diagnostic support service to families living with dementia, and that an especially designed training program like this one can provide eligible volunteers with the tools to perform and to cope, and also how to enjoy peer support work. Thank you for listening.
Thank you very much for your presentation. Are there any questions for May-Hilde Garden from Norway about this peer support group program? Come on.
That was a lovely presentation. presentation with very good ideas and that peer support groups. I can imagine it's very difficult. You seem to tackle a lot of problems already. I was wondering how these coaches, these peer coaches, how do they get in contact with carers?
We have provided peers with statements and flyers to send to daycare centers, to schools for carers, and also they have newspaper relations, and they get articles in newspapers. And they often go to, in Norway, schools for carers are really common, so they go to schools for carers, which maybe 20 to 50 carers attend a couple of times a year and give a lecture. So they are constantly interacting in the communities, and then they get callers or conversations.
I have a question for you. Do you have any measurable results? Have you tried to conduct a study, a pilot, in order to see, because they are effective, but...
No, we did not do that. We only did the focus group interview, and we see that if this is a useful way of working, we have to do some more study about this theme.